Stomach 25 is 2 cm lateral to the midline at the centre of the umbilicus. Stomach 29 is on the lower abdomen, 1 cm superior to the pubic bone, 2 cm lateral to the midline. Kidney 14 is on the lower abdomen, level with Ren 5, 3 cm superior to the symphysis pubis, half a cm lateral to the midline. Kidney 15 is on the lower abdomen, 4 cm superior to the symphysis pubis, at the level with Ren 7, half a cm lateral to the midline. Ren 3 is on the lower abdomen, on the midline. It's 1 cm superior to the symphysis pubis. Ren 4 is on the lower abdomen on the midline, 2 cm superior to the symphysis pubis.
Spleen 1 is the medial nail point of the big toe. Be sure to locate this point off of the nail bed. Try and tuck it in to the flare of the base of the distal phalange. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Spleen 8 is located 10 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having problems locating the medial crest of the tibia, just raise the foot slightly and this should enable you to palpate it. Don't press too hard, this point can be quite tender on women. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Kidney 2 is located distal and inferior to the tuberosity of the navicular bone. To find this bone, place your finger on the medial malleolus and then move down and slightly anterior until you come to a very prominent bony lump. If you come too far forwards, you will fall onto a different bone, the cuneiform bone, but it doesn't stand out so much. When you find this bony lump, mark your point, kidney 2, just distal and inferior to it. Kidney 6 is located 1 cm directly inferior to the prominence of the medial malleolus. Palpate down 1 cm and feel for a cleft in between 2 tendons. Kidney 6 lies in that cleft. A common mistake is to palpate down only half a cm and to try to locate this point in the ankle joint. It's not in the ankle joint, it's in the cleft between the 2 tendons that are inferior to it. Kidney 8 is located half a cun anterior to kidney 7. First locate your kidney 3, move up 2 cun to find kidney 7, then move half a cun anterior to find your kidney 8. Kidney 8 is off of the medial border of the tibia. The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 cun anterior to kidney 10. Liver 9 is located 4 cun superior to liver 8. We know the patella is 2 cun long, so we can use this measurement to help us calculate the distance between liver 8 and liver 9. Liver 9 lays in the cleft between the muscles sartorius and vastus medialis. Gallbladder 39 is located 3 cun superior to the prominence of the lateral malleolus. It's in a groove in between the lateral crest of the fibula and the peroneal tendon. Get your patient to avert their foot against resistance to reveal the peroneal tendon. Be sure to locate this point in the groove between bone and tendon, not posterior to the tendon. Gallbladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the 2 metatarsals, you'll be able to feel a nice groove in between their shafts. Gallbladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief. Stomach 36 is located approximately 13 cun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cun inferior to the inferior border of the patella.